I'm Barbara. Hi, everyone. Welcome to our second teach-in. We're so happy to have you. This is sponsored by National Single Payer and Senior Disability University. All right, we are recording this session. Hope it's all right with everybody. We want to share it with people who weren't able to make it, okay? So thank you. We hope this teaching will be informative and you'll take the information back to your friends and groups you are connected with and bring more people the next time. This is our second one, but we intend to keep going one way or another. I would like to give a special thank you to Senior Disability Action for all your help with this, with Senior Disability University for all your help with these teach-ins. We really appreciate your help on this. Okay, and let's see. We'll have two speakers again. Anna Melanow, an MD and retired pediatrician, and is involved in the healthcare reform for over 20 years. Tonight, her topic is exchange health insurance subsidies between a rock and a hard place. Isn't that a great title? Thank you. She's gonna.
Are we going to get crushed?
Yeah. Okay. And then Valielza O'Keefe. She is a great organizer who's part of National Single Payer, and she's also county council member of the San Francisco Green Party. And tonight, her topic is what is a win number, and why do we need one? And why do we need to think about one for ourselves? More wonderful organizing tips. Thank you. Okay. There'll be a Q&A at the end, and this will be your chance to ask questions or make a comment and tell us what you're thinking. Okay. And we're also going to ask people who tried out the calculator for you and your to calculate you and your healthcare costs with single payer. Okay. We'd like to know how you made out with that. If we need to, we're going to stay on longer than 8 o'clock. We get into a really good discussion. There's plenty of questions coming in. We're going to be here for you. Okay? Thank you so much for being here. All right. So I'm going to turn it over to Anna now. She's going to be our first speaker.
Thank you, Barbara, for that wonderful introduction. And I'm just thrilled with all the people who are attending our second teach-in. I'm going to share my slides right now, but if people don't mind muting, just so that we make it so that it's a little bit easier for everybody to hear our speakers. So here is a slideshow that should pop up pretty soon. All right, wonderful. And I hope everybody can see this. So yes, what we're going to be talking about today is the exchanges and the health insurance subsidies between a rock and a hard place. We're going to be doing a deep dive into the US healthcare marketplace, how single payer activists respond to really two horrible choices. And I would like to thank the Senior Disability University, Grace Clark and Ligia Montano for all their work putting this together and hosting us, as well as Valiosa, who is my co-speaker from the San Francisco Green Party. And yes, also National Single Payer. So let's go ahead and get started. I really like this quote from Robin D.G. Kelly. The state is not being deconstructed, it is being repurposed. And I think that that is an appropriate way to start our conversation today. For those of you who were here last time, you remember that we talked in our first teach-in about how the patchwork healthcare coverage in the United States is not normal. That I like to think of the US healthcare system like a pie. But for those of you who were here and forgot or were not here, we're just going to do a very quick review. So if we think of the US healthcare system like a pie, about half of us are insured or have healthcare coverage through our employer. So about 160 million people in this country have health insurance through their employer. Now that means that the worker pays a certain share of that monthly premium, and then the employer pays a certain share of that monthly premium, and the two of them together make up the whole monthly premium that allows that employer and their dependents to be covered by that health insurance plan. Now, that's one slice, which is in that blue slice. Another slice is the orange slice. The orange slice are individuals and their families who also have private health insurance, but they do not have an employer who pays that other share for it. Typically, before the Affordable Care Act, individuals would have to purchase private health insurance on their own. But as we will see, as a result of the Affordable Care Act, that it is now the government that is paying the share that is typically paid for by the employer. So at any rate, this is what we call the non-group or the individual health insurance market. Then in that yellow slice are the 65 million individuals who have Medicaid. In that red slice are the 60 million individuals on Medicare. In that bright green slice are the 9.1 million veterans who have the best socialized healthcare system in this country through the Veterans Health Administration. And that leaves that slice, that purple slice of the uninsured. And these are the 26 million individuals in our country who are not covered by health insurance at all. Now, one thing about looking at a pie chart like this is that it's really simple geometry. And if you say you were going to make that blue slice bigger and that orange slice bigger and that yellow slice bigger and leave the red and the green slice the same, by definition, by making all those slices bigger, you're going to make the slice, that purple slice of the uninsured, smaller. And that is exactly what the Affordable Care Act tried to do. Despite its name, the Affordable Care Act decided that they were not going to try to make healthcare affordable. What they were going to do is to shrink the size of the uninsured. And so they did that by passing an employer mandate, and that made the blue slice bigger. They passed an individual mandate, meaning that all individuals had to have health insurance and their dependents and their families, or they would get a fine. So they passed the individual mandate. They also expanded Medicaid. So they expanded that yellow slice. They did nothing to Medicare, nothing to the VA. And by definition, because they made that blue slice bigger, the orange slice bigger, and the yellow slice bigger, that slice of the uninsured, that purple slice, became smaller. And almost overnight, not quite overnight, because as we know, the Affordable Care Act had to go through courts and the Supreme Court and so forth, but kind of overnight, the number of uninsured went from 50 million people to 25 million people. And today it sits at 26 million people. So what we're going to be looking at today is the orange slice, which has become known as the Affordable Care Act, ACA, or Obamacare marketplace. So that's where our deep dive is going to be today. Now, what we're going to be doing is we're going to be looking at health insurance subsidies. We're going to be looking at the enhanced subsidies, at the government shutdown, and about choosing the real solution. So let's go ahead and get started. Before we start on the health insurance marketplace, let's go back to 2010, when the median annual household income was about $49,000. That means that's sort of kind of like the average family would make $49,000 made in 2010. Now, back in 2010, the annual cost of health insurance for a year was $12,000 a year. And that didn't even include the deductibles. It was just the premiums that these people in the non-group market had to pay on their own. Now, if you made this law that it was mandated that as an individual in your family, you had to buy health insurance, it meant that for the median household in the United States, that health insurance would take up 25% of their income. Now, what about if you were making minimum wage, which is only $15,000 a year? Well, if you paid $12,000 of your $15,000 a year, that would take up 80% of your income. So it was impossible for the federal government to pass a law saying that you had to spend up to 80% of your income to pay for health insurance or you would get fined. So the government came up with a very convoluted way, because this is the American healthcare system, of trying to help workers pay for private health insurance. And how did they do that? Well, they created this marketplace that allowed individuals and their families to purchase private health insurance outside of the employer market, so in the individual non-group market, and they called these the health insurance subsidies. Now, subsidies, because as I said, under employer-sponsored health insurance, the worker pays a part of the premium, the employer pays a part of the premium. Well, under the individual market, in that orange slice, the government would now pay for that share of what the worker didn't pay for. And if the worker made very little money, then the government's share was bigger. And if that worker made a little bit more money, then that share of the government's share of the premium would be smaller. So these were based on income, and according to their income, individuals could purchase different types of metal tiers. Do you remember the metal tiers? The bronze, which was really crappy health insurance, the silver, which was a little better, the gold, and the platinum. Now, what ended up happening is that, yes, the government, the federal government, paid for the premiums. So it protected workers from having to spend, up to 80% of their income on the premiums. But what it did not do, and it allowed them to have sometimes very low monthly premiums, but it did nothing about the deductibles. And the deductibles were very high, into the thousands of dollars every year. And that's a big problem, because even while your monthly premiums are small, are low, if your deductible is really high, in the thousands and thousands of dollars, then you're basically become underinsured. Now, what happened to that slice of the pie? It grew under these health insurance subsidies from 8 million to 11 million people. But what the ACA did is that it did shrink the number of uninsured, but it greatly expanded the number of individuals who became underinsured. Now, when Trump came into office the first time, what he did, he and Congress eliminated that individual mandate. Do you remember that? But he did nothing to improve the marketplace for Americans. It was just that now it was okay to be uninsured. You wouldn't be fined if you were uninsured. And one part of the population that was kept very, very happy, those were the insurance companies, because while people struggled to pay their medical bills, these insurance companies were collecting tens of billions of dollars every year from Uncle Sam, plus the premiums from the individuals and their families paid every year. Now, insurance companies collected billions before they ever had to pay out a penny. So that's the thing about the deductibles, is that yes, your monthly premiums can be low, but if your deductible is $10,000 for your family, you have to spend $10,000 that year and every year before the insurance company kicks in one penny. So those were the health insurance subsidies. But then came the pandemic. Now, in March of 2021, the Democrats pushed through a 2-year expansion of the Affordable Care Act in the COVID-19 relief bill. And what that relief bill included were something called the enhanced subsidies. So that meant that the federal government would now pick up a greater share of that monthly premium, because suddenly people found themselves either unemployed and no health insurance in the middle of a pandemic, right? So the federal government said, okay, because so many people are losing their jobs, we're going to enhance the subsidies and make it easier for people to afford their monthly premiums. And some people paid $0 in monthly premiums. And then the other thing is that they also increased the federal poverty level amount that you could get these subsidies. So it expanded the number of people that were eligible for these enhanced subsidies as well. Now, there were just 3 caveats. Number one, Huge deductibles. For a family of four, a deductible might be $18,900 a year. So yes, your premium was zero, but your deductible was $18,000 a year that you had to pay in before the insurance company kicked in a penny. Now, this meant that people either got health care and became bankrupt or just avoided health care altogether. Number two, it came with an exorbitant price tag. In 2022, right after this COVID bill was passed, this legislation directed about $20 billion to insurance companies by making larger premiums, subsidies available, and to more consumers to buy these qualified plans. And then number three is that these subsidies would expire December 2025. And that's the reason we're talking about this today. Now, in the meantime, these health insurance premiums continue to increase, right? So these, the health insurance, yes, it was crappy, but it still meant this lifeline to millions of Americans who lost their jobs during the pandemic. And one thing that I failed to mention is that the slice of the pie went from 11 million and now with the enhanced subsidies, it increased to 24 million Americans. Now, unfortunately, instead of using a once-in-a-lifetime pandemic to make healthcare a human right for everyone and expand Medicare to all, Congress worked double duty to expand Medicaid and to enhance the subsidies, but nothing to pass Medicare for all. Now, it's important to point out that while the government was paying larger and larger shares of health insurance premiums for more and more people, health insurance premiums continued to rise without pause. The government could have told these insurance companies, okay, well, we will pay, our share of these premiums, but you can only increase the cost of premiums by 3% per year or whatever inflation is. But of course, nothing of the sort happened. And if we look this is from the Kaiser Family Foundation. If we look at the increasing premiums for families, say average families from 1999 to 2025, and we just sort of zero in on 2014, which is when the exchanges were launched, you can see that the price of health insurance premiums continue to rise and rise and rise. And as a matter of fact, cumulatively since 2014, it's gone up 60%. So the government continued to pay and pay and pay. Workers didn't see that increase because they continued to pay zero premiums, right? But higher and higher deductibles, of course, if they got health care. Now, I love this from the Kaiser Family Foundation because it looks at the gross margins per enrollee in the marketplace, and that's the left-hand column. And as I said, exchanges were launched. The ACA exchanges launched in 2014, and you can see that these health insurance per enrollee were not making very much money initially. It was only $60 per enrollee in 2014. In 2015, wow, they even lost a little bit of money. But by 2016, they kind of, got into their game, and then they started making more money. And in 2017, more money, and 2018, and so forth until 2023, when per enrollee, the gross margin in the individual marketplace is $1,048, which when you compare that to the group market, which is the employer-sponsored health insurance, it is more money than these insurance companies are making with employer-sponsored health insurance. So that just goes to show you that health insurance companies love the exchanges because they're getting a lot of money per enrollee. Now, the current debate is interesting because it's little wonder that the CBO has recently predicted that expanding the health insurance subsidies over the next 10 years is going to cost $350 billion. So about $35 billion per year. Remember, it was like 20 billion initially, and now it's up to $35 billion per year. Now, the expiration of these enhanced subsidies is estimated to more than double what subsidized enrollees currently pay annually in premiums, about 114% increase. So obviously, people are going to get sticker shock, and which is happening on November 1 when these individuals are going to be getting letters from their insurance companies. Now, saying that they're fighting to protect healthcare for Americans, the Democrats refuse to pass a budget bill unless the enhanced subsidies are permanently expanded. Okay, so that's their ask. And they say that we're not going to sign a bill unless we get that. Now, the Republicans seeking a bill to temporarily extend federal spending at current levels without any add-ons say no, we don't agree with that, and that the Democrats want to spend billions of federal dollars on undocumented immigrants, which is really not true because these federal subsidies are prohibited by law from being used on undocumented immigrants. Now, as a result of this intransigence in both parties, the United States federal government shut down in the early morning of October 1 after Congress failed to pass funding for federal programs and services. And I believe that today we're on day 30 of the government shutdown. So now I think that we sort of understand the health insurance subsidies, right? Where they come from, what these enhanced subsidies are and where they come from, and why we have a government shutdown, right? Now, Democrats, instead of shutting down the government for real health reform, are quibbling over subsidies that keep Americans underinsured and in medical debt, and importantly, continue pouring billions into the health insurance corporations' till. How should we, as single-payer healthcare activists who believe the only solution is to kick out profit-seeking corporations from the healthcare system and demand a national single-payer improved Medicare for all, free from profit healthcare system, react? Well, we are between a rock and a hard place, right? Do we support Democrats and enrich the very corporations we are fighting so that 24 million people can continue to pay for some form of health insurance? Well, I believe that yes, in the short term, we support the very temporary extension of the enhanced subsidies, not a permanent enhancement. And we fight for single payer because we know that the real solution is sitting in Congress right now, H.R. 3069, improved Medicare for all health insurance. It would give us comprehensive benefits, including prescription drug costs, dental, hearing, vision, long-term care. We would not have any private insurance premiums, no copays, no deductibles. We would have one people, one plan, as Barbara Cummins likes to say. We wouldn't have, the employers and the exchanges and the Medicaid and Medicare and so forth. No, it would be one people, one plan. Yes, we would still have the VA, we would have the Indian Health Service, and they would be properly funded and not privatized. We would save $450 billion per year and 68,000 lives, unnecessary deaths every year if we had an improved Medicare for all. Everybody in, nobody out. So documented, undocumented makes no difference. If COVID taught us anything, is we need everybody in and nobody out. Now, this H.R. 3069 does allow investor ownership of health providers, which we must improve, but that would be the topic of another teach-in. So I am done, and I will hand this over to Valielsa. We don't have a date in December, but we're going to have teach-in number 3 in December. We're going to be talking about Medicaid and how Medicaid cuts are cutting patients, workers, and communities. And we have lots of other topics in mind as well. And that's a QR code that you can use to find out more information about when the date in December is going to take place. So I am going to stop sharing, and now Valielsa can take over. Thank you. And then we can take questions at the end. Thanks.
Thank you so much, Anna. Okay, hopefully there isn't an echo. All right, thank you so much. Let me just go ahead and pull up my slides. All right, hopefully, can everyone see my screen? Fantastic. Okay, So, hi everybody. My name is Valley Elza. I'm a county council member of the San Francisco Green Party. I'm also a member of National Single Payer, and I work really closely with Anna. I also did want to shout out my wife, Christine Wynn O'Keefe. She's also one of the founders of Students for a National Health Plan at the UCSF Medical School, and I think we have a couple of the folks from UCSF Med here. Thank you so much for coming. I also have a couple of my comrades here from another organization that I'm a part of that I recently started called Solidarity Now. So thank you so much for coming out. And yeah, today I wanted to talk about a little bit more of the political side of our organizing. And I wanted to talk about what the win number is for our national movement. And so, what is a win number and why we need to think about ours is something that I think is really useful. My background, I come from a background of like direct person-to-person organizing, but I've also done some work in electoral campaigns, so someone running for office. And a win number in that context is the number that you need to comfortably win an electoral campaign. And so the way you try to figure out what that number is about 52 to 55% of expected voter turnout. If you want to have it really tight, it can be 50% plus one vote. But they say typically, if you want to be really comfortable that you're going to win, you want to try to estimate a little bit more than 50% and how many people you actually need to get into contact with. So, for example, if you're running for a race in a county and your county has 20,000 registered voters, but based on past year's elections, you know that the turnout is going to be somewhere around 43%. If you do the math and you take 43% of 20,000, then you know your expected voter turnout is really going to be closer to 8,600 voters. And so your win number would actually be 52 to 55% of that proportion of voters that are actually going to turn out, which would be closer to 4,400 or 4,700 voters, depending on how conservative you want to be with your estimates. And I think this is really interesting thinking about this. And sorry, today's presentation will be a little bit math heavy, so bear with me, but I'm hoping that the math isn't going to scare anybody off here. If I can manage, I'm sure everybody else can manage. But it shows, I think, something really interesting, which is to win an electoral office, you really only need a minority of the population to win. I feel a little bit strange pointing this out because I don't want to imply that, democracy is important and that we don't care about majorities. But when you actually look at the amount of people that turn out to vote for a variety of reasons, which we can talk about at length, and the amount of people that actually will vote for a given cause, you find that the number of people you need to win is really a minority. And I think this is something that we can use to our advantage, is something that I kind of want to keep in mind, because I think when we think about something like national single payer, this broad campaign that's going to affect the entire country, it can be really uh discouraging to think that, you need like the entirety of the US population behind you. And of course, we're not an electoral campaign. We're not trying to get anybody specific in office. It's much more abstract than that, which makes it even more difficult. But I think it's really useful to put this concrete thinking to our use in this campaign. I think there's a mentality to campaign organizing that's really useful in that we need to have massive reach and growth. We need to get as many people involved as possible, which I'm sure everyone is very much, on board with. But I think the thing that I really want to emphasize is that we need a similar mentality with voter contact and constantly engaging people. And if anybody here has worked on a campaign or volunteered on a campaign, which I'm sure many of you have, it's very much until election day, until you've gotten that victory, you're engaging people until the very end. And there's never really any limit on contacting and engaging with voters, right? Because every single interaction can lead to more votes for your campaign, get you closer to victory, and give you a bigger margin of victory. So I really want us to try to incorporate that mentality a little bit when it comes to our campaign. And so if we wanted to try to calculate what our win number could look like, something that's really encouraging is that we already have all the support that we could need. If this was on the ballot and people were able to say if they support or oppose Medicare for all, we already have a majority. So this is actually an Economist YouGov poll from July 2025. And it says Medicare for all, which I know isn't exactly national single payer, but the last poll I could find for national single payer was like 7 or 8 years ago. So we'll substitute with this one. So we still have very much a majority that puts us really comfortably in that win number category. We have 59% of people that at least somewhat or strongly support our initiative, which is really, really good. I think we would be fighting a very uphill battle if we didn't have that behind us. And personally, this is a big reason why I'm really passionate about this fight in this moment, especially post-COVID and post things like the United Healthcare CEO murder. I've been seeing a lot of itching for this policy. And I think we're in a really, really unique context where this can actually happen. And so this poll also had some really interesting data with targeting specific demographics, which I think is also something that a lot of campaigns will try to focus. They'll try to focus on which demographics are most likely to vote for them, where do they already have a strong base of support, and what can we start to target? Because unfortunately, we don't have infinite resources. Even, the most corporate of Democrats or Republicans don't have infinite money. So they have to decide where they're going to spend that money, where they're going to target their advertising, their voter contact, and so on and so forth. So a really interesting aspect that I really want to point out here is that if you look at the ideological support or political party ID, we have a lot of majority support, obviously, in Democratic areas at 85%. And we also have majority support in independent heavy areas. So this is people that, or these are people that identify explicitly as independent or are unaffiliated on the ballot, which is actually the majority of Americans. They are also in major support of our policy. Republicans are not in major support of our policy, but I would contend that that's something we still should pay attention to because 34% is still a significant plurality. And I'll talk a little bit more about Republicans towards the end. So I think when you look at this data, the first thing that I would contend is Democrat heavy and independent heavy areas are both areas that we should look at targeting because those are people that are already in ideological support of our movement, and they're going to be the people that are most likely to participate and volunteer and show up for us when we need it. Another interesting facet from the same poll, they also took a lot of other data. They also looked at race and they also looked at age. And two other things jumped out at me that I thought were really interesting. For example, if you look at the race data, in Black communities, 84% of people are in very strong support of Medicare for all. And I think this is also something that we should capitalize on. And this makes sense to me personally. Black voters have always been the most progressive, radical voters out of any other voting bloc, most consistent supporters of leftist policies. And so I look at this and I see 84% support, which is pretty close to 100. I'm like, okay, we need to be using a lot of the Black community, Black majority spaces to help build support for this campaign issue. And I think this is something that we should really continue to explore. And this is something that makes me really excited because I don't think that this sort of thing has been explored very, very much before. I also look at the age demographics and see a really interesting trend of the older people get, they are less in support of Medicare for all, which is fascinating. And if you look at the 18 to 29 age bracket, we have 70% support. And personally, this is why I think engaging people such as Students for a National Health Plan and other youth-facing groups will also be really important because it seems that the younger cohorts are really, really in support of this policy. And so the more that we can engage the youth, college-age students, graduate-age students, and of course, young healthcare workers, I think it'll be really, really good to continue to build support for this cause. So those are some really interesting things that I was able to pull out from the data, and I think things that we can use to continue to target our organizing and build our movement. And this is pretty much everything that I already said verbally. Although something else I will also point out is Hispanic communities. I'll just go back a slide here. We also have 58% support in Hispanic communities. And I think that's also something that would be interesting to target. And that's why I'm really happy to have people like Lika here that are really focused on making sure that we have exposure for Spanish-speaking people and making sure that we have materials available for them. Many of them that are first-generation immigrants have immigrated from countries that already have nationalized healthcare. And so I think it's the mindset. We don't really have to convince them of that as much. I also wanted to provide this map that shows how many countries actually provide universal health coverage. And if you look at Latin America, well over half of the countries have some sort of nationalized healthcare. And so a lot of the Hispanic immigrants that have immigrated here recently are going to have that recent memory. And at least in my experience, I am Hispanic. I can speak to the fact that a lot of them are like, yeah, it's very much a duh thing. Why doesn't the United States have this? So I think that's also something that would be really good for us to target in terms of thinking about where we can expect the strongest support and continue to build support. So now going back into the party affiliation is what I'm going to focus on because I think this paints a really interesting picture for how we can think about the country and where we can actually target our contacts and build days of action and things like that. Because of course, like I mentioned, we want to target where we have the most Democrats and the most independents based on that poll data, if we're using that poll data. And I found some really interesting data looking at these maps and figuring out where the bulk of Democratic voters actually reside. It actually surprised me quite a bit. Of course, we had your usual subjects with California and New York, which makes sense. And they both have had, a lot of history of strong statewide single payer movements. But I was also surprised to see some of these other states rank pretty high up in Democratic voter proportions, specifically states like Louisiana and Kentucky. And I think we have, a mixture of states here that sometimes are portrayed as red states because of how they swing for the presidential election, but that doesn't necessarily reflect the actual registered voter demographic, as in how many Democratic voters actually live in these places. So on top of, or in addition to California and New York, we also have Pennsylvania. DC by far has the highest proportion of Democratic voters at 75%. But then we also have states, like I mentioned, like Louisiana, Kentucky. And so these are places where we're probably actually going to find a lot of, positive sentiment towards our movement. I'm really excited because I think I saw someone in the chat or someone in our teaching today that's actually tuning in from Kentucky. And so I think that, kind of proves the point a little bit. And I think these are places where we can really expect to find the most return for our investment. And similar, I also thought it was really interesting looking at the map for the highest proportion of independent voters throughout the country. Some of these were unsurprising, but most of them were extremely surprising. I personally lived in Boston for a couple of years, so I was blown away to find that the highest proportion of independent voter registration was Massachusetts, but apparently it is at 65%. Of course, we also have Alaska at 62%, and then, I think less surprising states like Colorado, Nevada, and of course, New Hampshire, I think, has a huge reputation for a lot of independent thought. But Rhode Island also took me by surprise at nearly 50%. So I think these are states where we're going to find a lot less, partisan support. They're not really going to be concerned as to whether or not it aligns with one party or the other. I think we'll find more free thinkers in these areas and also more support for our movement. So also some states to consider targeting. And I have tables here. I'm so sorry. I really hate when people do this in scientific presentations and just bombard people with tables. It's ugly and it's not helpful. But I did just want to show a little bit how I tried to arrive at a sort of win number by looking at the number of Democrats and independent voter data. And so what I did here was I took the number of total registered voters in a specific state. So here I listed all the Democratic majority states, or high proportion of Democrats, I should say. And then I calculated the actual number of Democrats by taking that percentage. So for example, in California, we have 18 million, multiplied by 45% to get like 8 million. And then I took a proportion of those Democrats. So based on the YouGov poll, we saw that 85% of Democrats were supportive. So I said, okay, this is the number of supportive Democrats that exist, 7 million in California. And then calculated our win number based on the turnout. Like if they were to come out to an election, what's the likelihood that they would actually come out and vote? And I calculated that number by just looking at the average turnout of the past 4 or 5 presidential elections, which was somewhere around a little bit shy of 60%. And so based on that, we can actually see that there is a pretty massive base of support in each of these states. And it adds up to a little bit less than 10 million, which is, a really big number. But personally, I look at these numbers and I see, wow, like that is a lot less than the, 100 million people or like 300 million people that I thought would have to be on their side for this movement. And I also think it points to the fact that we can expect a lot of really positive growth in the short term. And I did the same thing with the independents. Surprisingly, I think this also points to my own biases here. I thought that there would be more Democratic voters to expect, but there actually is much more independent voters. And this makes sense because I think the largest portion of registered voters in America identify as independent or unaffiliated. So this is actually going to be the biggest block of support that we can expect in these states. And so I did that same sort of calculation, looked at the YouGov data. It was 57% of independents. And then this is the sort of win number that I got by looking at all that independent data. And I wanted to get back to Republicans here. This is actually an article that recently came out in AP News a couple days ago, referencing the government shutdown and how people are extremely frustrated. And essentially, Republican voters are, pressuring their legislators about what the plan is for health insurance. And I think what this shows here is that even though that the majority of Republicans may not be in support of national single payer, they desperately want some sort of plan and they want some sort of assurance that their health insurance is going to be continued, that they're going to have consistent coverage. And I think this points to an opening in the fact that, especially in the face of the government shutdown, people are realizing how reliant they are on the government and how they very much need some sort of, uh, some sort of coherent policy. So I was really happy. I mean, not that I'm happy about the shutdown or anything that's happening, but I was happy to see this because I think this is just further proof that even on the other side of the aisle that claimed to be opposed to national single payer, I think there actually is an opening to make a case to them as well. So we shouldn't ignore Republicans just because they say they may not be in support. There's still at least 30% of Republicans that would be in support of national single payer. And I think they would be a really, really valuable addition to our coalition. Something else to consider here. So I'm sure this is on people's radars after No King's Day, but the 3.5% rule was something that kind of kept coming up on my feed. And this is just the idea of what it takes to, this is an idea that was developed by Dr. Erica Chenoweth from Harvard. And she looked at political movements throughout the 20th century, specifically political movements that were looking to oust a hostile government. And what she found is that typically they were successful as long as the movement included at least 3.5% of the country's population. And then they were successful at overturning that government. It's definitely a rule of thumb, not a hard rule, because there are a couple of exceptions. But for the most part, what she found is that if people were able to show up to some sort of mass event on a single day, and that mass event included at least 3.5% of the population, that they were able to successfully overthrow a government. So this is definitely interesting to keep in mind, and this is probably like a much easier way that we can look at our win number. It is definitely lower than the numbers that I had. So definitely something to keep in mind in that, you know, it's a much lower proportion, I think, than we tend to think in terms of what actually generates national change, right? Only 3% of the population needs to be involved in order to accomplish this. And so takeaways from the data, I think the biggest things that I really want everyone to take away from the data tonight is that there's a massive base of support that exists for, I shouldn't have changed this, Medicare for all or national single payer across all regions, so not just the elite coastal liberal regions, right? Across all parties to a degree, demographics, and especially the biggest thing that I want people to take away is that for a meaningful and effective national campaign, we actually don't need to target all 50 states, right? We just need to target the states where we already know we have a lot of support, and we're still going to be able to have a really strong national movement from that. And this kind of points to some of the things that I personally have been working on with some people in the call here, which is, for example, Students for a National Health Plan, they're planning on at UCSF forming a coalition across California, to activate medical students across the state. And I'm personally interested in also trying to get the Green Party at the national level to start to put this forward and prioritize national single payer as a campaign and putting more of our resources to it. And the next time we have a teach-in, something that I really want to talk about and definitely get more group input in is creating a timeline for growth with actionable goals. So at what point do we want to see growth in X state? How many organizers do we want to see in these states by this point in time? Because I think setting concrete goals with timelines will help us get a better sense of what we actually need to accomplish these goals. And the other thing that I want to say is I think our organizing really needs to, again, like take the mindset of electoral campaign organizing in terms of, getting people out there the same way that we would get people to show up to the polls and contribute in a concrete way. I think we have to constantly be engaging people. And I think we're doing that really well with our teaching tonight. Protests are also another good tool. I'm also really interested in exploring coordinated labor action, especially led by healthcare workers unions, such as nurses unions. And I also think our movement, being what it is, presents a lot of unique canvassing opportunities. So, for example, a lot of campaigns will like to go to residential areas to knock door to door. But I think since we are focused on healthcare, there's a lot of really interesting opportunities to go to any sort of hospital, healthcare facility, you name it, to do a lot of this canvassing and a lot of this education. So we don't have to be so limited in the traditional sort of like campaign strategies. I think we can afford to be really creative. And I think that also allows us a lot of visibility and allows us to fold more healthcare workers into the effort. And I know personally, based on the people I've spoken to, the more doctors and nurses they see like physically, really visibly advocating for this stuff, it's just going to encourage more members of the public to get involved as well. Yeah, and last time when I presented, I recommended these readings if you're more interested in learning more about like aspects of building up for a mass movement, but that's pretty much everything that I had to cover today. So thank you so much, everybody.
Oh, that was great. Um, so I think that Barbara is going to be leading our Q&A. I have not had a chance to keep up with the chat if people were putting questions in the chat. But Barbara, I guess, do you want to see if people raise their hand?
Yeah, right. Yeah, everybody, look at the bottom of your page and you'll see a heart with the word reaction. If you click on that, you're able to raise your hand. And then when you do that, I'll call on you and you can either give your question or you can give your comment. Okay? Does that sound okay with everybody? So I'll go down to the reactions and click on and then touch raise hand. All right, now we'll see what we have here. Let's see. Linda Ray has her hand up. Hi, Linda.
Hi.
Linda,
I just want
hi.
to double check on the issue of, yes, we support the subsidies because we're in this bad situation right now. And people are losing, will be losing their health care. So when you said temporary, I mean, the fact that the Democrats want this to be permanent is really irritating. I mean, they say they're for, some of them say they're for single payer. Of course, then when they really, they often vote against it or they try to not have it voted on, et cetera. But when you say temporary, what are we talking about? And then, I mean, I'm just like in a campaign about this, but we're right here in this situation right now about the close down. And I think both parties have to budge a little bit. But, would it be okay to say, okay, we'll extend it for a year and then, come back to it or something. But I was just curious what people's thinking is on this stalemate.
Yeah, thank you, Linda. That's a good question. Anna, do you want to try that?
It is a
This
really good
question?
question and one that I hadn't really thought about. I think that a year sounds reasonable. Unfortunately, in a year, I'm sure that we're going to be faced with this again unless we have people in Congress or a movement that pushes Congress to pass HR 3069. I mean, that's really where we need to be focused. If the Democrats want to negotiate and say, okay, well, we're not going to ask for permanent, we just want temporary, and the Republicans say, okay, well, we'll just accept temporary for another year. I mean, it's all really just a game, honestly. Unfortunately, they're playing with people's lives because we know what what it means to be uninsured in this country. We know that, and we know that it means it can mean medical debt, it can mean death. So I don't believe that this is a game, and that's why I think that yes, as single payer activists, we are between a rock and a hard place. I think something temporary like a year, and hopefully in the meantime, we work really, really hard to get that win number.
Okay.
More than a
All
year.
right. Yeah. Next person, Patricia Chadwick.
Hi, thank you. I just wanted to see if anybody had feedback on, there's this healthcare alliance with California, Oregon, Washington, and Hawaii. It was, around the vaccines mostly, but if there was any potential for, or people think there's any potential for doing a single payer health plan with just those 4 states, as a start, because they're pretty, I mean, California has got the biggest economy, and then the other states are pretty good too. So I don't know if what people's thoughts are about that. Thanks.
I can answer that. Yes, there has been consideration for a regional, because what we want to do is set up a model. And so far, Oregon and Washington, for instance, they've been very active in trying to go with their state-based plan, as well as California. Yeah, more so in Washington, and I think Oregon. We haven't gotten very far with our bills. But it would be great because that would be a big chunk of the country. And the demographics are different in each state. There's a lot of rural population, like in Oregon and places like that. So I think that that's a viable solution. I have not heard of people meeting from these three states yet, but I hope that will happen as another solution. Like Canada started state by province by province. We're aiming for state by state, but regional would be great too. And even over there in New York with teaming up with New England, the New England states might be a really good regional. Okay, thank you. The next person would be Carrie.
Yeah, hi. Something that I haven't heard addressed at all in anywhere actually is the fact that both health insurance companies and big pharma are all tied to the stock market. So what would that do to, I guess I'm just trying to figure out how we convince people that it will be okay in the end, that they shouldn't be making a profit off of us anyways. But that's a big chunk of where they put their money and their premiums. I know they invested in the stock market.
Yes, you're right about that. Healthcare, but this has been only in the last 10 years. It hasn't been longer than that. It started in about 2014 when it really started to go up. It's a combination of the Affordable Care Act money and the fact that the boomers are turning 65 at the rate of 10,000 a day. So there's so much healthcare business. And unfortunately, they decided to take it to the nth degree and put it on Wall Street. But that can be undone. And there's been some consideration for a divest from healthcare and put your money in climate control. It hasn't really taken off, but it's one possibility because truly healthcare should not be on Wall Street. It's up to $8 trillion worth of shares times the share price right now.
It's so disgusting.
Yeah,
the number, and everything is so inflated. I mean, the bills that my personal healthcare insurance get from a pharmacy that provides, I have a rare neurological disorder, but it's outrageous. They're billing them $85,000 a month for me to do my own infusions at home. It's just insane. It's insane to me.
Yeah.
And do we know that if we don't get an extension on the ACA, if they're going to be able to come after us for pre-existing conditions again? Is that part of this package? I don't understand. I don't necessarily know what all they're trying to take out right now.
Yeah, I'm not sure about that. Anna?
Well, so I just wanted to answer the previous question that Patricia posed. I believe it was Patricia posed about regional single payer. And I guess I have to say this, being in the steering committee of national single payer, is that we do believe that healthcare is a human right, must be free from profit, and will be achieved through national legislation. There is legislation currently that Ro Khanna has introduced called the State-Based Universal Healthcare Act that actually does allow for regional states to get together. But unfortunately, what that does is it dismantles Medicare as we know it and allows states to funnel Medicare funds, Medicaid funds, CHIP funds and so forth, and not necessarily create a single payer system in their state. Because if you read that bill closely, the word single payer did not come up once in that legislation. So, it would take longer than we have today for us to talk about why we don't, where I personally think that we need to push for national legislation. There is national legislation right now, and that's really what we need to be pushing for. I think maybe Ruth had mentioned in the chat that there will be obviously billions and billions of, well, probably not billions, but millions of dollars from the health insurance industry directed at direct opposition to any kind of legislation that we propose. However, I think that we can't let that stop us. We really cannot let that stop us. And regarding the stock market, I don't think that we should let that stop us either. Most workers do not have any savings in bonds that are in the stock market. So I don't think that it's going to particularly hurt retirees and workers, because that, working people just don't have the money to be able to afford the kind of stock in those industries. I think Ligia is next.
Yeah, well, I just wanted to thank you, thank everybody that is here, particularly our two speakers, Anna and Balielsa. And your presentation, Balielsa, gave me so much hope. So I'm just saying, this is good to know. Things look more achievable. So I wanted to say that for us at Senior and Disability Action, we've been part of the single payer, fight also, and I just wanted to make sure that everybody that is here would come back. So Anna said that we're going to have another one in December. So please come back, register, wait for the emails. And this time we did record the presentation. So we're going to share, before you leave, we're going to share our evaluation form. So please help with that. And I see someone else has his hand up.
Yeah, I just wanted to say that with regard to single payer and Medicare for all in the stock market, I think people need to keep in mind that stocks are constantly traded, and one industry is, doing better than another, and then it'll switch. And I mean, that goes on constantly. But if we look at the truth of the matter is that a single payer system like Medicare for all will boost our economy hugely, because it's going to free us up. It's going to save us. It will save us so much money, hundreds of billions of dollars a year. And that money will be in our hands. We get to go out and buy the things we want and need instead of having to give it in premiums and give it to those already rich investors. So it will be a tremendous boost. And this time the money will be coming from the middle and lower class, not just the people at the top. They won't be the only ones that can afford to buy things anymore. So I think it's going to boost our economy way beyond any damage that could possibly be done in terms of the stock market.